I'm Dr. Desiree D'Angelo. I work at Premier Surgical Network and I am a general and breast surgeon. A hernia is essentially a hole in the wall, is how I explain it to patients. The most common spots are at the belly button or in the groin. They can be other places. They can be in old incisions where a patient has had a previous surgery. But I describe it as the abdominal cavity is like a room and the hernia is like the window. It's a hole in the wall. So when you pressurize that room, stuff goes out the hole. And that's what creates the little lump that patients frequently see when they have a hernia. And that's what can cause pain because the stuff that's stuck in that hole starts to get constricted, the blood flow to it can get constricted, and that tissue can start to die, and that can cause pain. Hernias are diagnosed sometimes just by physical exam. Frequently I'll see a patient for a breast problem and I'll examine their abdomen and they have a tiny belly button hernia that they didn't even know was there. Sometimes they're diagnosed by CAT scan. Sometimes for another issue, they're having abdominal pain for something else and they're found to have, a small hernia somewhere. So for patients that come to see us at Premier Surgical Network for a hernia, there's definitely multiple treatment options depending on the size and location of the hernia. For small umbilical hernias, I typically offer open repair where we can actually repair the way the belly button looks during the surgery. As well for inguinal hernia repairs, I do those in an open sort of fashion where we're using mesh to repair them. Sometimes we offer laparoscopic repair for larger abdominal hernias. And sometimes myself and Dr. Saad, our plastic surgery partner, will do a complex ventral hernia repair where we're doing what's called a component separation, where we're releasing the fascia of your abdominal wall to bring things together to do a more complex repair. With treatment for hernia repair, it's important that patients have their hernias fixed once they're symptomatic because it could lead to an emergency type of situation. If important organs are getting stuck in your hernia, that can be a situation where we need to fix things right away, and it could lead to more extensive surgery. At Premier Surgical Network, you're going to get a personalized experience with your doctor since I'm the one that's always seeing my patients. I don't have a PA or other staff that helps me see my patients. You're always going to be seeing me and the staff that's here all the time. So everyone gets to know you really well. The recovery for hernia surgery is 6 weeks of no heavy lifting, which patients sometimes, grumble at because we all like to be outside and exercising and doing fun things, but it's very important for after hernia surgery that we follow these lifting restrictions because it takes your body 6 to 8 weeks to really develop the scar that's going to heal the repair, that's going to keep the repair intact. So if we're doing a physical activity before those 6 to 8 weeks, you're at a higher risk for a recurrence of your hernia. If a patient thinks that they have a hernia and they want to make an appointment at our office, they would just call and make an appointment to see myself or Dr. Iucci, since we are both the two doctors in Premier Surgical Network in Southern New Jersey who are caring for hernia defects.